Dr. Ann Hike. She's a holistic medical doctor here in the Valley. So you specialize in thermography. Well, you specialize in a lot of things, but you do thermography. And what is it used for?
Thermography has been used in medicine for a variety of modalities. They use it in pain medicine, they use it for orthopedics, chiropractic, but I use it for early breast cancer detection.
Does it really work? I mean, that you can actually see the lumps, you can see changes in the breast with it?
When a woman has breast cancer, the patterns of the breast, which are normally cool, will light up like a hot spot. And I'll show you a few images in a few, in just a few minutes, Dr. Karfeld.
Yeah. Great. So, when a woman then comes into your office, I mean, what should they expect? I mean, what does the procedure kind of involve? I mean, I assume that you don't do what to do with the mammography, where they, put them between two cool irons and just squeeze the heck out of them, right?
40 pounds of pressure.
Yeah, exactly. So, what does the procedure involve in thermography?
Well, we have a special room and we cool it down to 66 degrees. A woman has to disrobe from the waist up, and she has to be 10 minutes in this cool room, and usually our technician, who's always a woman, is asking her questions about her breast health. And then she has 6 pictures taken, frontal and then from both sides, and these digital images are sent to Detroit to be read by Dr. Hoekstra, who is a specialist in thermography.
So why do they have, why do you cool it down that much? I mean, why is it cool in that room, and why do they have to stand there for that long?
When they first came out with thermography back in the 80s, and they were trying to make it into a preventative modality, they had mammogram wagons going around, and they put the thermograms on there, and they got very imprecise measurements and almost had to do away with thermography as a detection device because the door was opening, the door was closing, and the temperature variations made it inaccurate. So now they've standardized things so that they're getting very accurate readings.
But there's no squeezing involved, meaning no
compression, no radiation.
Beautiful. And you have a little bit of an image show. I know there's some images that you want to show, and I'm really curious. You can, if we can just flip to the first one here. So what does this show?
This is a normal mammogram, and the purple indicates this woman has cool breasts, and you can see as we get further up her chest, it looks more like it's on fire, which is normal because if we weren't warm in those areas underneath the armpits and underneath the breasts and the liver and spleen area, the woman would be too cold to survive. So this is normal.
Okay,
Why don't we look at the next one?
Okay, let's move to the next.
So this woman has very hot breasts on both sides, but she should because she's a nursing mom. And so the next one, this is completely normal for a nursing mom.
Okay, perfect.
This woman has early breast cancer, and it's on the left side, and there's a little moon-shaped yellow area, which indicates increased heat.
Okay, so and breast, a cancer that they generate, there's more blood supply to the cancer, and that's why it's warm then?
That's exactly right, Dr. Karfeld.
So let's go to the next one then.
So again, this lady on her left breast has increased heat, which is very indicative of breast cancer with that wavy yellow line and the white.
So is this further along then than the one that we showed that we saw
it would be
earlier?
more advanced cancer.
Oh, okay.
And this final picture is far advanced. I mean, you can see the lady is not only has white and yellow, but her breast is elevated compared to the left, which means she's scarred down.
Oh, okay.
So, I mean, these are very easy images for us to read. Sometimes they're a little bit more gray, and that's why we send all of our images off to the specialist to read.
And I was just curious, it was green on that previous shot also.
Okay.
What was
Can we go back?
What was the green about?
Green is cool.
Oh, that's cool also? Okay.
Green's cool.
Okay, green is cool. We're in the green era. Green is cool. So So when you then find, I mean, a woman comes into your office and let's say you find then a spot that you're concerned about, what is the next step?
If a woman comes into my office and she has a breast lump, I send her for a mammogram and ultrasound,
Okay.
especially if she's postmenopausal. What we're talking about here is screening, which is that women come in and they want to know, do I have breast cancer? Do I have very early breast cancer that can't be detected? Now, I have this little toy here, and this shows us the relative times that we pick up the breast cancer. So this would be if a woman detects breast cancer by checking her breasts, or if a doctor does. These two are X-ray mammograms. These two are the MRIs, which is a very expensive procedure and time-consuming, and will probably will not be screening. And these two little BBs show us the early breast cancer detection of thermography. It's 5 to 8 years earlier breast cancer detection than mammograms.
So not only is it safer, I mean, you're not squishing then the cancer cells, nor are you radiating the breast, but also you're able then to detect it 5 to 8
years earlier.
So, I mean, it doesn't make any sense why this is not something that's implemented medically.
And then we should go, let's talk about diagnosis. Can thermography diagnose breast cancer? The problem is if you have cancer that's this small, you're not going to be able to get a biopsy because you won't know exactly where to put the needle because it's so tiny.
Yeah.
So thermography does not diagnose breast cancer. Only a pathologist who is reading a biopsy specimen can diagnose breast cancer. So that means the MRI doesn't diagnose breast cancer, ultrasound doesn't do it, mammograms don't.
So it's only the biopsy. I mean, you pretty much got to get in there and then see what kind of cells that you got.
Yes.
Oh,
and
okay.
Sometimes women will have abnormal thermograms and then I have to send them for a mammogram, and they say, well, I was trying to avoid that. But the mammograms are better at locating calcification so that they can do the biopsy.
Okay.
So it's not a standalone. If a woman has a normal thermogram, though, her chances of having breast cancer in the next year are almost 100% that she will not have that.
That's amazing. Well, thank you very much, Dr. Hike.
Okay.
It's truly a pleasure.